Hello, good morning, and welcome everyone to today's Financial Arrangements webinar. My name is Jacob Borkover here with the webinar team at Rectangle Health, and I want to thank you all for being here today. I know we all have super crazy busy days, and thank you for taking the time to join us today for this really great presentation. And thank you to our presenter, Stephen J. Anderson, for being a part of this today. I know everyone is very excited to hear all the great tips you have for their practices. So, before we jump into the main event here, just a few quick housekeeping notes. So we'll get a lot of questions throughout the webinar. I want to make sure I get all the information to you right off the bat. So this is a 1 hour and 15-minute course valid for 1 CE credit. We are PACE accredited to provide CE through the Academy of General Dentistry. So you will be receiving CE credits via email sometime before the end of next week. Please be patient as we have a bunch to process. So make sure you're on the lookout next week. Check your emails to get those CE credits. This will be AGD subject code 550, financial management. So just a quick note on that. If you're joining us today on mobile, if you have the ability to get to desktop, please do so, since it is a better viewing experience and it will be easier to answer the polls. If not, we understand. And then we are going to have 4 polling questions throughout the webinar today. That's how we know whether or not you're here. And for our accreditation, that's how we keep it in terms of making sure that you're participating. So when those questions pop up, please do your best to get your answers in. We want to hear what you have to say and also want to make sure that you're paying attention. So at the end of the webinar, we're going to have a brief survey pop up for you. Please fill that out. It's really important for us as we continue to improve and learn more about providing the best webinar experience for our valued attendees. We're also going to give 3 lucky webinar survey respondents a $25 Amazon gift card. So make sure you guys fill out the survey so that we can learn more and hear from you on what you thought. Our next webinar is October 20th. It's a live HIPAA and cybersecurity training with our Director of Compliance Solutions, Terry McDonald. It's a really fantastic presentation. I'm going to put a link to sign up in the chat, and it'll also be in the follow-up email. We get a lot of questions about whether or not we're going to send out the recording. We will send out a recording follow, so you'll have a chance to review anything that you may have missed here. But please note, if you pop off and just watch the recording, you won't be able to get the CE credit, so don't do that. If you have any questions today, please place them in the chat in the questions bar. And then if you have any questions you want to email us, I'll put the support email in the chat as well. And if you have any technical issues, contact GoToWebinar support directly. Well, that is a long list of housekeeping items. So without further ado, I'm going to introduce our main event. If there was one phrase to describe Stephen J. Anderson, it would have to be the yes man. He has worked with professionals around the world to transform their practices, businesses, and their teams to top 10 performance status with innovative patient service systems that make it easier for patients to say yes to treatment. He has worked with some of the biggest names in dentistry to build their practices. His system transforms practices and the people in them. He has been named Dental Businessman of the Year by Excellence in Dentistry. He is a founder of Total Patient Services Institute, Crown Council, and the Smiles for Life Foundation, which has raised nearly $50 million for dental and children's charitable projects around the world. He is the author of numerous books, including The Culture of Success, 10 Natural Laws for Creating the Place Where Everyone Wants to Work. He is one of the most prolific entrepreneurs, authors, philanthropists, and presenters in dentistry, and we are excited to have him with us here today to present financial arrangements that get a yes. So without further ado, Steve, the ball is in your court.
Perfect. Thank you, Jacob. You read that exactly the way my mother wrote it, so thank you for that.
I had it memorized.
Sounds good. Great to be with all of you today. This is going to be a packed few minutes that we're going to spend together today. And so I hope you be prepared to take lots of notes. I promise you that there will be things in here that you'll be able to use immediately. And we'll also, in addition to the polls that we'll be taking, there'll be 4 of them today, as well as grab your cell phone, because there'll be some opportunities to use that as well in the next few minutes. And before we get done, there will be some resources that we'll make available to you to implement what we'll talk about today. As Jacob mentioned, I'm the founder of the Total Patient Service Institute, TOPS for short. We are an education and implementation company that implements the highest level of patient service systems that get a yes to needed treatment in practices all over dentistry. We've done that for a minute or two, and we have worked with some of the biggest names, biggest practices in dentistry. We have an entire army of practice advisors that are out in practices implementing our systems every day, including today. I'll refer to that because a lot of the research, a lot of the things that I'll refer to today have to do with the active day-to-day work that we do with dental practices. I'm also a co-founder of the Crown Council, which is an international group of leading practices that are committed to getting or creating a culture of success in their practice. And that is an entire community of leading practices that are committed to providing the best patient service and the best work environment for their practices. And I'll refer to that today as well. So with that, let's talk about financial arrangements. And to get started, as you all know, today's webinar is being sponsored by Rectangle Health. I will mention some resources that they have available that will help with your financial arrangements efforts today. All right, first poll, Jacob. Everybody gets to vote for their most challenging financial arrangements objection. So you get to select one of the following. That would be your most challenging objection that you face on a regular basis. So you get to go and you get to vote for one of these. I need to think about it. That's more than I was expecting. Won't my insurance cover it? That's way too much money, or I can't do that right now. So you get to vote for the one you find most challenging that you face on a regular basis. So go ahead and vote. And whichever one wins as the most challenging one, then we're gonna go ahead and deal with that one straight out of the chute so that you have something that you can use today when you hear that from a patient. So which one do you choose? I need to think about it. That's more than I was expecting. Won't my insurance cover it? That's way too much money, and I can't do that right now. All right, Jacob, why don't you go ahead and close the poll? Let's see who wins. And you may have to give me the results here, Jacob.
Yeah, so we had 33% said I need to think about it. That was our leading one. 23% said won't my insurance cover it. 19% said that's too much money and I can't do that right now. And then 7% said that's more than I was expecting.
You got it. So I need to think about it. Most challenging one, and I would agree, of all the different objections, responses that we train at the TOPS Institute, that usually is the one that comes out on top. So I'm going to share the solution to this. You can master this. You will hear it today. You'll hear it tomorrow. And I believe that good verbal skills are a learned skill. No one was ever born with great verbal skills. You learn it, you master it, you study it, you practice it. So here's the secret to this one. So if I were the patient and I said to you, I need to think about it, your response to me would be this: Steve, I think that's a great idea. With a decision this important, it's a great idea to give it the proper amount of consideration, right? So give them some comfort. Now, here's the key. This is the part to jot down. So Steve, what patients tell me when they think about treatment like this or similar to this, what they tell me is they think about one or more of three different things. Do I really need it? Can I afford it? Or is it gonna hurt? So do I really need it? Can I afford it? Or is it gonna hurt? So of those three things, which one are you gonna think about the most? And then you'll get their response. And our research, our study on this is they'll always pick one, maybe two, but they'll always respond with the one that's really most on their mind, or they'll come up with a different one. Then you have something that you can talk about that's their primary concern. So that's the whole key to that one. Is patients tell me when they think about treatment like this, they think about one of three things. Do I really need it? Can I afford it? Or is it going to hurt? Which one of those are you going to think about the most? All right. So, and then you can get their response and go to work on the one that's their biggest concern. So that is the key to that objection. Again, just as there's a system for clinical dentistry, there is a system for everything that has to do with case presentation, that has to do with financial arrangements. There is a best way to handle things. Now, it doesn't mean that it's always going to work, but it does increase your odds. So let's talk about increasing your odds of financial arrangement success. Here is the first principle. This is what I call a natural law. And that natural law says that we make decisions emotionally, and then we justify that emotional decision with logic. Here's my illustration. How many of you have ever gone shopping and bought something that you really wanted that you could not afford? Now, we've all done it. And if you say you've never done it, I'll ask you how many things you've lied about. In addition to that, we've all done it. Here's the key, is we do things that we want to do over and above the things we need to do. Now, beyond food, clothing, and shelter, the basic subsistence level needs, we more often will do the things that we want to do over the things that we need to do. Now, here's the fundamental challenge in dentistry. If we do what comes naturally in dentistry, we default to the scientific method as the business model. Now, what's the scientific method? It's taught in every dental school and hygiene school in the country. And that scientific method is diagnose, treatment plan, present it, and then do it in that order. It works for science. But when you adopt that as your business model, then things come off the rails. Basically, as a consumer, what we hear as the consumer public to that scientific model is, come on in the first time, and we're going to charge you up front to identify problems you never knew you had, and we're going to come up with a big plan that's going to cost more money than your mind will ever be able to wrap its arms around, and you're going to get really excited about doing that. It doesn't work. That's one of the reasons people don't like going to the dentist. When was the last time a patient walked through the door and the first thing they said to you was, "I hate the dentist"? And I know you hear that so often that what you want to say back to them is, "Yes, and you're ugly," but you can't say that. One of the reasons that people don't like to go is because of this whole deal. We approach every patient like a problem, and we dig in to find all the problems that they didn't have, and then they don't want to do it, right? Because we failed to figure out what they want. And this entire system is based on want, figuring out and understanding what people really want and helping them get it. And here's the key: patients don't want procedures. They don't want procedures. They don't want a crown. They don't want a filling. They don't want veneers. They certainly don't want a root canal. In fact, there is nothing that you do that anybody wants. Okay, that's the course. Now, this is a reminder. They don't want the procedure. They want what the procedure will do for them. This is basic stuff, and we violate it every day. What do they really want? They want better quality of life. They want a better appearance. They want higher self-esteem. They want social acceptance, peace of mind, better health, better longevity. Those are the things that people really want. I'll refer back to this several times in our discussion, but this is a key principle: is great financial arrangements are based on helping patients get what they want. In other words, what the dentistry will do for them and the ultimate benefit. This is an entire team operation here. The whole team needs to be engaged, because great financial arrangements start from the very first interaction. What we're trying to avoid is this. This is what we call DOA for financial arrangements, dead on arrival. Now, if you're a financial coordinator, you have had this experience where a patient has been dropped off at the front desk for financial arrangements, and you know within moments that it's going to be nearly impossible to get a yes. Here's why. Here's the biggest symptoms of the dead on arrival problem. Number one, the patient has been given too many treatment options. Treatment options are not a friend to successful financial arrangements. If I'm the patient and I've been told, well, Steve, you can do this, or you can do that, or you could do this, or you could that, and I have 3 or 4 different options to choose from, I will do nothing because I don't want to think that hard. What needs to happen is a solid recommendation that's based on what the patient wants and what you've determined that they need and married together so they have a clear path forward. So it would sound like this. In the clinical area, it would sound like this. If I were the patient, you'd say, Steve, based on what you said you wanted when you came in today, which is to keep your teeth for life, stay healthy, and have the peace of mind of knowing you're doing everything you can to have the best health and appearance outcome. Based on what we have seen today and the exam we've done, this is what I would recommend. Just like that. And then you give your recommendation. I love that word recommend. It's one of the most powerful words I know in terms of case acceptance and getting a yes. A clear recommendation in terms of what the treatment is going to be. One treatment plan, not a bunch of options. You can tell them there are other options that will get them less than what they said they wanted. There's always options, but based on what they said they wanted and your clinical expertise, this is what I would recommend. So you can take that back to your clinical team and train them on that. One treatment plan, if at all possible, is a key to successful financial arrangements. Hazard number 2 to dead on arrival is treatment that gets phased out over time without input from the patient. So if we're not careful, we judge the patient. Well, they can't afford it, so we're going to phase the treatment out over 10 years and let them pay it out that way without giving them the opportunity for input, timing, what they can afford, all those things. So if treatment, it should never be phased out just because we assume the patient can't afford it. Third DOA hazard is when the financial coordinator has to present both the treatment plan and the financial arrangements. So when you have to do both without the clinical team's involvement. Now, if you have a treatment coordinator, then there is a way to work that in. But if I'm a financial coordinator charged with presenting financial arrangements, it just compounds the complexity if I have to present treatment and answer all the treatment questions and then present financials as well. That will get less of the result that we want. So clinical teams responsible for presenting treatment and getting that dialed in, then the financial coordinator then can follow up with helping the patient fit it into their budget. Next DOA hazard is no treatment plan at all. In other words, the patient shows up for financial arrangements and you can't find the treatment plan anywhere and you're scratching and scraping to try and put something together or running back asking the clinical team what the plan is. You gotta have a treatment plan if we're gonna do great financial arrangements. The last DOA hazard is presenting comprehensive care to the patient who came in to just get their teeth cleaned. In other words, if they're not primed and prepped for what we're going to present and they thought they were coming in for a routine cleaning, and then we dump an entire load on them of all the things that they have to do without getting them ready for that, it will be a financial arrangements disaster. Just don't do it. So the ideal is this, that we have a clear treatment plan, that the patient is based on what the patient said they wanted, and they're excited to move ahead, and you can work with them hand in hand to fit it into their budget to help them get what they want. That's the ideal. So how do we get there? Well, you need a lot of luck. So this is my favorite definition of luck: when preparation meets opportunity. You have opportunities every day to present financial arrangements. So the opportunities are there. The key is the preparation. The preparation requires two things. It's what we call your toolbox. So it's the right tools, and we're going to talk about the right tools here in just a moment, and the right training. So you gotta have the right tools at your disposal, and you need to know how to use them properly. So let's start with the toolbox. What are the right tools? Here's your list. Number one, internal financial guidelines in writing. So this is a document that we recommend that has all of the financial guidelines for the financial coordinator to follow. This would include all of the different financing options that you can provide, the different ways that patients can pay for treatment, third-party financing options, all of the things, in other words, all the boundaries, if you will, the guidelines that you can follow when presenting financial arrangements. So this is an internal document. The patient never sees it, but it is the guideline for the internal team to follow when presenting financial arrangements. And the entire team should be familiar with this document. Even if you're on the clinical team needs to be apprised, and they need to know how we do financial arrangements. Number two, the external financial guidelines. So this is the document that the patient signs. You may be familiar with it with the financial agreement or financial responsibility. We like to call it financial guidelines, that not only shares with the patient what their financial responsibility is, but also what your part in it. I love external financial guidelines that start by saying our commitment to you is to provide a clear explanation based on our diagnosis and treatment planning, so that you clearly understand what we're recommending and why, and helping you get what you say you want. And your responsibility is then XYZ, to pay in a timely manner, all of those things. So that external financial guidelines. Number three, you need a treatment plan. If you're going to do financial arrangements with a patient, you gotta have a treatment plan so you know exactly what the plan is that's been recommended. Number four, you'll need the schedule. You need to be apprised of what the openings are for the doctor and in hygiene, so that when you do financial arrangements, you can schedule concurrently and get both of those locked down. Number five, third-party payment options. So what are the different options that you can draw on in case the patient needs financial assistance or would like to spread those payments out over time? So what are your third-party payment options, and have those ready to go. A nice pen, yes. So they're making a significant financial commitment. So don't be using the free Bic pen. I love Bic, but not for this purpose, that you got from the auto mechanic down the street to sign their financial arrangement. Use a nice pen, and then do it in the right place. All right, so let's take a quick poll, Jacob, which is, where is the best place for financial arrangements? So here's your options. Is at the front desk, chair side, the consult room, or all of the above. All right, so you get to choose one of those where you think is the best place to present financial arrangements to get the best result. So at the front desk, chair side, consult room, or all of the above, where you think would be the ideal place to get the best result for your best financial arrangements, and getting a yes from the patient. All right, Jacob, let's close that out, see how we did.
All right, 76% said consult room, 12% all the above, 9% chair side, and 3% front desk.
Very interesting. All right, excellent. Glad we got the feedback. Here's the answer, chair side. So in all the research that we've done, this may surprise you, is chair side gets the best financial results. Now there's a couple of guidelines here. Here's why. Here's the law that basically says, what I call the natural law, is that physiology impacts psychology. So physiology, our breathing, our posture, everything with how we hold ourselves, our physiology impacts psychology or how we think. So if I'm the patient and I've been sitting in the chair for say an hour plus, and then you move me into a different space to talk about financial arrangements, here's what we found is that the moment my feet hit the ground, my mind automatically goes out the door in my car, and I'm now running 5 different errands in my mind of all the different things I've got to do. So if you've ever felt like if you're in the consult room or the front desk where it's challenging to keep the patient's attention because they seem anxious or they want to get away, so our recommendation is test doing financial arrangements chairside. Now, the bigger the case, obviously, and the more involved it is, it may not make sense to do it chairside, but for a lot of procedures it is. With these caveats, if you're in the state of California, there is an actual law that says in healthcare, including dentistry, you cannot present third-party payment options in the treatment room. So if there's any kind of loan or any kind of financial commitment, you got to get them out of the treatment room. The reasoning there is that they don't want patients making financial decisions under anesthesia, right? So it mainly came out of medicine, but it also impacts dentistry. That's the state of California. I'm not aware of any other state where that's the issue. It may be, but in the state of California, you can't do this. So that would be one to test and see. Again, you got to turn the room, you got to stay on time, all of those things. That may be limitations to doing this. But in terms of psychology, chairside may get better results. All right, next ingredient is what we call a relationship link. So this is not a handoff. This is, again, it takes the entire team to do this correctly. We're not just handing off the patient and their treatment and saying, Mr. Anderson's ready to check out. A great relationship link sounds like this. From the clinical team to the financial coordinator would sound like this. So let's say that Susan is my financial coordinator. And if I were the patient, what you would say to Susan is you would say, Susan, we've had a great visit with Mr. Anderson. And based on what he said he wanted when he came in today, which is to keep his teeth for life, stay healthy, and have the peace of mind of knowing that he's doing everything that he can do to stay healthy and maintain a great appearance. Based on what he said, Dr. Jones has made this recommendation in terms of next steps and treatment. And then you talk about the treatment, right? What the recommendation is. Then any other concerns that the patient has, you might say, now timing's really important for Steve. He's got a very busy schedule. He travels a lot. So we need to work to make sure that we schedule these appointments in times where he has the least likelihood of any kind of an interruption in his schedule. And then you turn to me and say, Steve, what did I miss that we need to talk about in terms of the treatment plan before Susan talks to you about the financial arrangements and the scheduling? What have I missed? Okay, I didn't say what questions do you have. I asked, what have I missed? What I'm trying to do is separate the clinical discussion from the financial arrangements discussion. That's the goal. So a great relationship link where we connect what's happened clinically to then what's going to happen with scheduling and financial arrangements. So if you're the financial coordinator, then your next step would be to say, Steve, if it's okay with you, may I go ahead and review your treatment plan that you and the doctor discussed? I'm always going to lead with a question, and always keeping in mind what the patient said they wanted, because that's, if we're going to do anything, it's because the patient wants to do it. All right, so we're going to talk about what not to do as well as what to do. Here is what to do. So this is a formula, a system for presenting financial arrangements that has an acronym tied to it. That acronym is BRIEF, B-R-I-E-F, which stands for the following. Begin with the benefit, review the findings or review the treatment plan, introduce the fee, explore concerns, and then finalize the plan. All right, so those 5 things. Let's take a look at each one of those in depth. First, begin with the benefit. So as we mentioned from the very beginning of our webinar today, it's all about what the patient wants. Wants before needs. I'm going to do what I want to do many times over the sacrifice of what I need to do, unless I'm in like chronic pain, right? It's all about what's in it for me. What's the benefit? So this is the word picture. This is an M&M, as you can tell, a peanut M&M that has 3 parts to it. The candy coat on the outside is the dental procedure, right? That's the obvious piece. That's what we all see. We all see the procedures. That's what's in the treatment plan. The chocolate is what the patient wants, right? In other words, what their primary interest is, what their concerns are, right? That's what's going to drive their behavior, is what they really want. And then the peanut on the inside is why they want it. So I may want to keep my teeth for a lifetime. I may want to have better health, maintain my appearance. Why? What's the story behind that? If you understand my story of not just what I want, but why I want it, then the treatment follows, right? So we're always going to stay plugged in. Every step in the patient experience is always continue to stay plugged in to what I said I wanted, what my goals are, and what it is I'm really trying to accomplish. So I'm going to begin with the benefit, reiterate that as the leading piece. Now, here's some things, here's what not to do. I'm going to give you some things before we get into this that you're going to eliminate. These are some key words that have crept into the dental vernacular in financial arrangements and other places. We got to get rid of them and replace them with better words. Number 1, you're out of pocket. When you're presenting financial arrangements and talking about money, especially as it refers to insurance, you don't ever say you're out of pocket. I don't know who came up with that term. It's a horrible term. So, I mean, think about the word picture. If you said to me, Steve, you're out of pocket is, what am I thinking? I'm thinking of empty pockets that you just drained. So it's not you're out of pocket. Get rid of that phrase. Instead, let's use the word your portion. The 2 words, your portion. So Steve, here, your portion is XYZ. Now here's the other one. Your insurance will only cover $500. So if you said to me, so Steve, the fee for this is going to be $1,500. Your insurance will only cover $500. So your out of pocket is $1,000. Well, you set it up to fail, because now you're making it sound like my insurance is not going to cover much. So instead of saying your insurance will only cover, we're going to say your insurance savings. So Steve, the investment for the recommendation the doctor's made is $1,500. Your insurance savings is $500, which leaves your portion $1,000. That's exactly how we recommend it be presented. Finally, get rid of all the technical terms. So don't be talking about tooth numbers. Don't be using dental jargon in your financial presentation. Just get rid of all the technical terms, and let's stay focused on what the patient wants and what the ultimate outcome will be. So those are some recommendations of things to eliminate from your vocabulary as we proceed. All right, so next step in our brief formula. So the first is begin with the benefit. Then number 2 is review. So review the plan, review the treatment plan. So you would say to me, so Steve, the doctor's recommended gum therapy and a crown on your upper right, or whatever it is. Again, you're going to see this word recommend a lot because it's such a powerful word in case acceptance and in financial arrangements. So you're going to review the plan. So again, begin with the benefit in order. So the goal here, Steve, is keep your teeth healthy, et cetera, and to help you get to that goal, Dr. Anderson has recommended gum therapy and a crown on your upper right. See how that follows? So benefit first, then here's the plan that'll help you get there. Now, step number 3. So we begin with the benefit, review the plan, introduce the fee. So this is exactly how you would introduce the fee. So Steve, your total is $4,000. We estimate your insurance savings to be $1,500, which leaves your portion $2,500. Now, in contrast to, you would say, so Steve, this treatment is going to cost $4,000, and your insurance, your insurance is only going to cover $1,500, so your out of pocket is $2,500. I'm exaggerating a little bit, but I've heard worse. So again, your total is $4,000. We estimate, because it is an estimate, we estimate your insurance savings to be $1,500, which leaves your portion $2,500. That's how we introduce the fee. All right, so begin with the benefit, review the plan, introduce the fee, and then explore concerns. So when you introduce the fee, you can grab your cell phone here real quick. This is a TOPS recommendation. This is, well, dental warranty is the only third-party warranty program in dentistry that covers restorative dental work up to 6 years, no fault. So if anything has to be repaired or replaced during that 6-year period of time, the warranty will cover that work, and as well as pay the practitioner to repair or replace that work. So what it provides is peace of mind for the patient of knowing that their investment is covered. So you can scan this QR code, and the dental warranty team will send you the peace of mind roadmap of how you can design a peace of mind program in your practice that gives your patients the confidence in their investment. So that's a recommendation that'll add to your financial arrangement success. All right, now let's talk about exploring concerns. So if the patient has some concerns about how they're going to pay for this, this is the place to do it, right? So we're going to explore any concerns that they might have, and this is where we will put together whatever the payment arrangement is going to be. More on that in just a moment. All right, so then finally, we're going to finalize. So begin with the benefit, review the plan, introduce the fee, explore concerns, and then finalize the plan. So Steve, if we could fit this into your budget, would that make sense? Should we go ahead and get that scheduled? Would morning or afternoon be better for you? We're going to get the yes, so then we can finalize the schedule, get this financial arrangements signed off, and on we go. All right, so that's the brief formula. Again, I'll give you a resource for this here in just a moment. All right, so here's the last recommendation before we get into exploring concerns. This is a key to increasing financial arrangement success and making sure the patient shows up for treatment, is separate the payment from the appointment time. So the payment should be different than when they actually have the treatment done. That is to prevent the financial flu. That's where the patient wakes up sick on the day of treatment. What they're really sick about is having to pay $2,500, right? So we're going to separate the payment from the appointment time. Financial arrangements will have payment dates when it will actually be paid, but I want to keep that as far away from the actual day of the appointment as possible. All right, so there's the formula. Begin with the benefit, review the treatment plan, introduce the fee, explore concerns, and finalize. Okay, quick poll. Let's talk about exploring concerns and how we actually put the payment together. So, Jacob, we have another poll here. This is how many ways are there for patients to pay for treatment? Because this is what great financial arrangements are all about. So you get to select one of the following. How many ways are there for patients to pay for treatment? Either 4 ways, 8 ways, 10 ways, or 12 ways. How many ways are there to pay? Different ways are there to pay for treatment. So you get to choose based on your experience in your office, how many ways can they pay for treatment? All right, I'll give you about 10 seconds more to vote on the different ways to pay. All right, Jacob, you want to close that out? And the results are?
78% said 4, 19% said 8, 2% at 10, and 1% at 12.
Perfect. All right. Thank you, Jacob. Would you be surprised to know that there are over 30 ways to pay? All right, so are you ready for this? Here's what we know about great financial arrangement skills is that many patients aren't aware of all the different ways that they can pay for treatment. So a great financial coordinator is going to have this arsenal of different ways and different options that they can pay for treatment, because if a patient wants it, then our job is to help them find a way to pay for it or a way to budget it. So this is a partnership model. We're not trying to get them to accept treatment as much as we are sitting side by side, helping them get what they want. There's no amount of wizardry in financial arrangements that makes up for a patient who doesn't want the treatment. If they don't want it, I got nothing for you. I can't do great financial arrangements and help a patient who doesn't want the treatment. They gotta wanna, right? That's the prerequisite. So once we've established the want and it's something that they wanna do, now we can work together to figure out, okay, what's the best way to pay for this? So rapid fire here, I'm gonna give you over 30 ways that patients have paid for treatment. And the whole science behind this is, if you have these on your radar, then as the financial coordinator, you can suggest to the patient different options or different ways that they might be able to pay for treatment. Okay, so here's the obvious ones. Obviously, dental insurance, if they have access to dental insurance, is a way for partial payment. Not 100%. Insurance doesn't cover 100% of everything. We consider it, that's why we call it your insurance savings, right? Because it does help them save on the total cost of their care. So dental insurance is a way to pay. They can pay cash, right? They can pay by check. I'm showing you all the different ways they can pay for treatment. They can use a credit card. Now, here's what I'd recommend here. A lot of times a practice will say, well, we don't take American Express because the discount rate is too high, whatever it is. Again, make it easy for people to do what you want them to do, right? Make it easy. So adjust your fees accordingly. We highly recommend that you do a fee analysis every year to make sure your fees are competitive in your marketplace. I'll give you a resource for that if you haven't done that recently. But adjust your fees accordingly so then you can make it convenient and easy for patients then to pay for the treatment they need and still come out profitable in what you're doing. Debit card, make it easy for them to use their debit card. Text to pay. So this technology is great, especially for accounts receivable. If you're trying to clean up your accounts receivable, the text to pay option is a great way to do that, as well as, again, we're making it easy for patients to pay for treatment. QR codes. So if you have a QR code that's attached to your payment portal, your payment system, then it's really easy for them just to, if they're there on the phone and they have the different payment credit cards and accounts in their phone, then they can just scan this and pay for treatment right there. Email to pay. So if you have the system set up where you can send them an email and they can click right in the email that takes them to the payment portal, it makes it easy for them to pay. Same thing with your website, is to have a payment portal icon on your website so that they can do it either right there when they get home. Again, we're making it easy for people to do business with us and easy to pay. Apple Pay, to do that, PayPal, there's all kinds of different ways, Venmo, Zelle. So our recommendation is get all these different payment methods dialed in so that it makes it easy for you to take payment accept payment from your patients. So whatever their Cash App is. All right, moving on. Flexible spending account. A lot of times patients don't recognize the fact that they can use some of their flex spending money on dentistry. They think a lot of it in terms of healthcare, but a lot of times dentistry is not on the radar. So you can suggest that. Do you have a flex spending account, or do you have an HSA, a health savings account? Those are two different things. Typically, they'll either have a flex spending account or an HSA. They don't usually go together, but one or the other. So you can ask for both. 401k. Here's the beautiful thing about how most 401ks are set up is you can borrow from your 401k and be the bank. You don't have to liquidate it. You don't have to make a withdrawal, but most most 401k plans make a provision for loaning or borrowing money from yourself. You can pay yourself interest as long as it's paid back in a certain period of time. So that's another option you can suggest if you're really searching and trying to help a patient for the best way to pay for it. A tax refund, patients have paid for treatment with a tax refund. If they have precious metals saved up or stored up somewhere, do you have it? Patients have paid with precious metals. You can divide up the payments based on whatever the treatment schedule is. You might have some money down today. You might have some before you start the prep work. You can divide up payments, right? As long as you keep it within the boundaries that are in your internal financial guidelines. You can have a prepayment courtesy. So give them a slight discount if they pay everything up front. That's a way patients have paid, and it's an incentive for them to go ahead and pay all of it up front. So you're done and you don't have to worry about the money. This is a great idea, $1 a day. So we recommend this for just basically 2 procedures, either whitening, or if you're doing any kind of invisible braces or any kind of ortho in your practice, you can do a payment schedule over time if the treatment's being done over time. So one of my favorite questions on the dental history form is this: if you could whiten your teeth for an investment that anyone can afford, would you be interested? If you could whiten your teeth for an investment anyone could afford, would you be interested? And then the response to that, if they say yes, is then chairside, you can say, Steve, I see you're interested in whitening your teeth. Would you consider $1 a day to be a pretty reasonable investment? Well, most people say $1 a day. So great. We can get started whitening your teeth today, and it's just $1 a day or $30 a month until the balance of whatever you charge for whitening is paid off. And then you just have to have a payment scheduling program through your credit card processor that will just clear their card for $30 every month until that whitening procedure is paid. So that's another way that patients have paid. Third-party financing, gotta have a source for third-party financing. One that Rectangle Health offers is called Care Now, Pay Later, patient financing. And so we recommend, you gotta have easy third-party financing available for those patients who may not be able to take care of the balance today. So that's part of your patient financing arsenal. Cosigner, so having a third party sign with them if you're getting third party financing, if they do or if they don't qualify, having somebody co-sign with them. So then you can say, is there someone who could co-sign with you? Maybe a relative opens up a third party financing account. Maybe a relative or a friend pays for the treatment outright. Patients have paid that way. Cash in a savings bond, right? Look to their savings. Cash in stocks or bonds or CDs. Again, these are all options of ways people have paid for treatment. Sell an old car. Are you getting to the point where you say, Steve, you're being ridiculous? These are all ways patients have paid for treatment. So if you want to be a great financial coordinator, you got to be creative. Home equity loan, many times people have a line of credit that's available to them on their home, or sell something on eBay or Facebook. Again, these are all ways that patients have paid for treatment. Do a layaway program where they pay in advance, right? So if they don't qualify for third-party financing, they don't have anybody that can pay for it, you can say, great, why don't we set up a layaway program where you can start paying today, and we'll save that up, and then we can begin the treatment so in other words, they pay in advance over time leading up to the treatment that they need. That's another way to do it. So that's a lot of different ways to pay. And there's even more than those, but that was a quick laundry list. So quick poll, would you be interested in a platform or a solution that incorporates all the ways to pay? This is one just quick answer, yes or no. I'll leave that poll open as we go through this next piece. So go ahead and you can just select yes or no on that poll question. Would you be interested in a total solution that incorporates all those different ways to pay in an easy format? So here's what we're shooting for with great financial arrangements. It's agreed upon treatment, a signed financial arrangement, got to have it in writing, a scheduled appointment, and a happy patient that is excited to get started with treatment. That's the goal. That's what patient commitment means. And that is the ultimate of great financial arrangement success. All right, I'm gonna give you a 10-question quiz, 10 marks of great financial arrangements. Number one, are your practice financial guidelines in writing? This would be the internal document. This is a yes or no question. Are they in writing? You got to have the guidelines in writing so that everybody's plugged in to great financial arrangements. Number two, do you have a written list of financial options? So we've given you 30 today. Do you have a written list available just to remind yourself of all the different ways that patients can pay for treatment? Number three, is your whole team aware of what all those options are? Number four, do you have a solid relationship link before presenting financial arrangements? That's a whole team effort to make sure everything is linked up the way we've described it today. Number five, do you present one treatment plan, right? Just one treatment plan, not a bunch of different options, but one treatment plan so the patient's very, very clear on what the recommended treatment is. Number six, do you present one fee? Not a line item, here's what each part is going to cost, but one fee. So for everything we've talked about today, Steve, your investment is, and it's one fee, not broken out into a bunch of separate fees. Number seven, do you present the office financial agreement when presenting financial arrangements? So again, this is the patient's financial responsibility. You present it again when you present financial arrangements. Do you have patients sign the financial agreement? All right, so once you've agreed, do they sign off on it? Number nine, are you using the brief formula when presenting financial arrangements that we've talked about today? And number 10, do you measure results with regular accountability, right? So do you keep track of your hits and runs, using a baseball analogy, or things that maybe didn't work out so well? So you measure your results so you know that you're being successful. So those are 10 marks of great financial arrangements. Here's a resource. You can pull out your phone again, another resource. This is the I Can Afford It Financial Arrangements ebook that has the 10 questions that we just went over today. It has recommendations that we've covered, as well as some additional resources for financial arrangement success. So you're welcome to scan that QR code with your phone, and that ebook will be available for download. That's from the whole team at the Total Patient Service Institute, with great financial arrangements secrets and the formula for implementing what we've talked about today. All right, with that, I'm going to take a couple of questions. Number one is, and if you have any other questions, you're welcome to put them in the question box on your control panel. Question number one is, this is great. So we talked about the fact that chair side is the ideal place to present financial arrangements. So Steve, if we can't do it chair side, where's the second best place to present financial arrangements? All right, so if you can't do it chair side, then the second best place is the consult room, right? A place where it's quiet, where it's away from other patients, where you can sit down and you can have a great conversation and work out the plan. So a quiet consult room that's been set up for that purpose. The worst place for financial arrangements is the front desk. They're standing there trying to get out the door. You got other patients coming and going. It's a very, very uncomfortable situation. So that's the worst place. So chair side's the best place. Consult room's number two. Worst place is the front desk. So avoid that if at all possible, and make all that work. All right, second question is, how do we get our whole team on board? I thank you for that. I'm glad you got the message that great financial arrangements are an entire team effort. So here's what I'd recommend is have a team meeting. We hope that you have a team meeting on a regular basis, but have a team meeting where you actually present. This is how we do financial arrangements. These are our internal guidelines. You could even share with them the brief system, the 30 ways to pay, all those things that we've covered today. So the whole team is in the know about how you do great financial arrangements the right way for success. It's an entire team effort. And then make sure you include the whole relationship link system, because that's the clinical teams, one of their real key roles that they play in successful financial arrangement. All right, so then finally, here's the question on how do we do the $1 a day? All right, so in addition to the verbal skills that I gave you, one of the key aspects, one of the key things you need is a payment plan with your payment processor. They can set up a platform where you can load in the patient, their payment information and dates, and then the amount, and then it will automatically clear those cards every month, give you a report, what cleared, what didn't clear, and then you can post the payments. And there is a solution now where those payments that will go through any credit card that you take or any payment that you take, there's now software available that'll automatically post that payment in your practice management software. Pretty slick. It's getting faster, better, and easier. So that whole platform, if you selected yes on the total solution, Rectangle Health has an amazing total solution that makes that much easier. Okay, enjoy the ebook. The ebook has all of my contact information for our team at Total Patient Service. If you have questions, it's just answers@totalpatientservice.com. Answers@totalpatientservice.com. The contact information is in there as well. Thanks for joining us. Jacob, I will send it back to you for CE credit and final comments.
Yeah, Steve, I've got one last question here.
Okay.
What is the best way to follow up with a patient that has given a no response?
Okay. So if they've given a no response, in other words, they haven't moved forward, what I want to know is why. And I'm going to record that. I want that in the notes so that the next time they come in, we can follow up. So here's the recommended verbal skill for that. If they say, not going to move forward today, whatever the reason, then it's what we call the permission statement. So you would say to me, Steve, I totally understand. With your permission, what we'll do is every time you come in, since we're committed to your total health, we will always give you an update on your current health and what our recommendations are so that you are always in a position to make a well-informed decision. Does that make sense? In other words, I'm paving the road for this to be a continuing conversation, not just a one-time conversation, but letting them know we'll keep coming back to this because we're here and we're all about helping you get what you want. So you open the door for a continued conversation. There's a lot more to that I could add, but that would be as a default before they leave, that you set that up for a future conversation.
Perfect. That sounds great. So with that, the CE is officially over. Before everyone pops off, a few quick housekeeping notes. If anything Steve discussed today, you were listening and I wish I had that, whether it be QR code payments, text to pay, payment plans, all these different solutions. At Rectangle Health, we offer them, and everything is best in class, and you have a myriad of different ways to accept payment. So if that at all interests you, we are going to be sending out more follow-up information. We've also placed more information in the chat as well. I've also placed the ebook in the chat. the link to the survey. We have our upcoming webinar as well on HIPAA, October 20th. So all of that information is in the chat, and we will be sending a follow-up email later today with all of that information as well, so you'll have it at your disposal. I've gotten a lot of questions in the chat asking about the recording. Everyone says, thank you, Steve, and they want to show it to the rest of their staff, so that's great to hear. We will be following up with a link to the recording as well in that email, so please be on the lookout for that. You'll also be receiving a call following up from our team. They're just going to be checking in, asking what you thought of the webinar, and then also extending some opportunities for you to set up a VIP installation of our payments integration solution. So be on the lookout for that phone call. And then, as mentioned, it is super important that we have everyone fill out the webinar survey so we can learn, get your feedback, and continue to improve. We will be notifying our survey respondents tomorrow who won our Amazon gift card. So we're going to be picking 3 lucky people. So be on the lookout for that. And then the most important thing that everyone always asks, and I have a bunch of questions here as well, is about CE credits. Once again, this is a 1 CE credit course. We will be sending out CE credits next week. So if by the end of next week you don't have CE credits in your inbox, you can shoot us a note. But it'll be there sometime probably Wednesday or Thursday of next week. So we appreciate your patience in advance as we have a lot of credits to process. So without further ado, we're going to let you get out of here a little bit early and get back to your day. I want to thank you, Steve. It was a really great presentation.
It's great to be with you.
I've got a 1999 Toyota Camry that I may sell to pay for my next treat.
Go for it.
But
it's a lot more today than it was 2 years ago, for sure.
Exactly. So thank you for being here today. We really appreciate our partnership and you taking the time out of your day to present to this group here. So with that, we'll let everyone go. Thank you again, and we'll see you here again soon. Take care.
Everybody.